Testing.
All right. Good evening, everyone. Thank you all for being here. We look forward to this opportunity to learn together this evening. My name is Nikki Goldfeder, and I am a counselor at Parkway Northeast Middle School, and I'm here with my team, Mr. Julian Mary-Segan and Ms. Janine Young, also counselors at Northeast Middle. And together, we have teamed up with the Parkway Middle School counselors and the Parkway Rockwood Community Education Program to bring a series of speakers to our community about different topics related to emotional wellness. We would like to thank the Parkway School District for prioritizing the emotional well-being of our students as we all work together to prepare our young people to go out into the world feeling strong and capable. This evening, you will hear from two dynamic presenters. Jessica Rosler is a licensed clinical social worker and registered play therapist who received her master's in social work from the University of Missouri. As a child therapist and former school therapist, she has worked with caregivers and children, ages preschool through adolescence, with a number of concerns related to attachment, trauma, anxiety, depression, and relational issues. She currently works as a therapist at Our Little Haven as part of the Keystone Mental Health Department that provides assessments and therapy for children and families. You will also hear from Dr. Erin Schulte, coordinator of guidance, counseling, and character education for the Parkway School District. Prior to earning her PhD in educational psychology from UMSL, Dr. Schulte was a school counselor. This is her 13th year in education, and she will provide information to you about how to access resources for your children. We hope you find this information useful as you navigate the complicated yet rewarding journey of raising children, and we are all here with you.
Thank you so much. All right, well, thank you so much for coming out tonight. We really appreciate it. I'm so glad for the opportunity to be able to talk with you all. So before I get started, we'll get the slides up there for you. Let me just get a show of hands about who I have in the audience, and I know it's from both Rockwood and Parkway school districts, but how many of you all have younger kids, preschool age? Okay, how about grade school? Both early and late grade school? Okay, great. How about junior high or middle school? And then high school. How many high school parents? Okay, and some of you maybe both. Maybe functioning in both types of schools, or two types of schools, or multiple schools. Great, so we have kind of a wide range. So tonight I will be covering, I'll kind of talk about what all I'm going to address in the presentation, but we will talk about kind of all those specific ages. And so all of you will kind of get information on the ages you're looking for, hopefully. So as you see, kind of what we'll be talking about tonight, as Nikki said, was childhood depression and anxiety specifically, and kind of more specifically what separates what we would consider typical challenges for every age group, and what might be something that you would be concerned about or what to seek help for. So kind of towards the end of my presentation, I'll talk about each specific age group, kind of some different challenges you might see, and then also kind of when you might want to seek help. So at any point if you have questions, raise your hand, or we'll also wait to the end. We can also answer some questions then. But I'll first start by talking just a little bit about me and where I work at. Like Nikki said, I'm a licensed clinical social worker and a registered play therapist. I have experience both in outpatient settings, also in the schools, and just have a passion for working with the kids and families specifically. My agency is called Our Little Haven, as she mentioned, and so we kind of do multiple different things. The Keystone Outpatient Mental Health is where I work. We also do foster care case management as well as a therapeutic preschool. And so in Keystone Outpatient Mental Health, we're comprised of 4 social workers and 4 clinical psychologists, as well as an administrative staff, and we do therapy with children up to age 12, and then we also do assessments and psychological evaluations for teenagers and children, as well as adults. And so we have funding from the city and the county. At the end of my presentation, I can give more information about how to contact us if you're interested in having your child be set up for an assessment for therapy, or if that's something you're interested in. But we do accept insurance, and we also have funding from the city and the county. So that's available. But just wanted to talk a little bit about that. So again, like I said, the first thing we'll kind of talk about is just a general overview of depression and anxiety in children, and also I'll kind of start with some statistics about. So thank you. All right, so the first statistics I'm going to kind of talk about, so I'll say before I start this piece of it that I think collecting accurate information about the prevalence of depression and anxiety is probably difficult. For the specific statistics I'm going to talk about, this came from the CDC, and the way they collected this information was just parents reporting, I believe if their child had been given a diagnosis over the past year. So this is not necessarily accounting for what we believe maybe the overall prevalence of depression and anxiety, which I'm going to assume is much higher than what these statistics say. People that aren't accessing a way to get diagnosed, aren't accessing services or can't access services. So, but these are just some numbers about what parents had reported the diagnosis their children had gotten in the past year, I believe. So 7.1% of children ages 3 to 17 had a diagnosed anxiety disorder, and 3.2% of children ages 3 to 17 had been diagnosed with depression. So how do we collect this information? Again, I'm not sure if this is like a true gauge, and I'll talk a little bit about some different statistics too, but still a pretty large number of children that had been diagnosed with those specific diagnoses, and a major concern being kind of a lack of access to treatment was one concern. And then when we talk about anxiety and depression, I kind of wanted to mention about co-occurrence, that anxiety and depression can co-occur pretty commonly, as well as anxiety and depression and other diagnoses of childhood. So like one thing that the CDC found was having another disorder is most common in children with depression. So about 3 in 4 children in that age group that had depression also had anxiety, and then almost 1 in 2 had other behavior problems. So that could have been a diagnosis of ADHD or something like that, but also just in general had more behavior problems. And then the rates of having been diagnosed with anxiety and depression among children ages 6 to 17 had increased pretty significantly in these 2 different time periods they collected information for the survey. And that's still the case, that we're seeing kind of a rise in anxiety and depression and also some other concerns. And another thing that I kind of wanted to note is that different from kind of what we had previously thought, that mental health disorders are occurring in a much younger age or can be diagnosed in a younger age than we thought. So they found that mental, behavioral, and developmental disorders can begin in early childhood. So 1 in 6 U.S. children aged 2 to 8 had a diagnosed mental, behavioral, developmental disorder, according to those CDC statistics. So again, kind of a difference from what we previously thought, that that's not something that can happen in little kids. That's not something they should experience or would experience. So we're finding that in fact is the case. And so the importance of early intervention for even those young kiddos. Okay, some more statistics here. So kind of talking about what are different factors related to getting a diagnosis, or different factors related to your mental health. So they found that boys were more likely than girls at that young age to have a mental, behavioral, developmental disorder. And there could be some different factors contributing to actually getting a diagnosis in boys, but they did find that that was more likely for males than females. Another factor, children living below 100% of the federal poverty level were more likely to have one of these diagnoses, so that was 1 in 5. So some factors related to economic levels. And both age and poverty level had affected the likelihood of actually receiving treatment. So looking at things like gaps in treatment. So unmet needs, barriers, homelessness, violence in the home, lots of things that may affect a mental health diagnosis in a child. And then culture, so really some of these things bringing that cultural awareness around different values and beliefs for you as a family, and for your specific family are important when seeking treatment, that those are being addressed. And so finding a provider that fits well with your family and your family's values is important. Another thing to note is that diagnosis is more common with increased age. So as we get into pre-ads and adolescence, we're seeing that those diagnoses are happening more commonly. And again, just some of the limitations of this particular set of statistics was the diagnosis accurate? It was parent reported, and did that match the medical record? So some things that may not be giving us kind of the exact picture of what's going on, but for example, other sources estimated that as many as 25% of children ages 13 to 18 had been affected by an anxiety disorder. So pretty high, and just some different risk factors that can lead to diagnosis or just to experience some of those things. So I'll kind of go here and just an overview in general of depression. So I want to say first that you would definitely want to defer to a mental health professional in terms of, does my child have this diagnosis? I know it's the practice at my agency and in my work to get a pretty thorough assessment of what's going on so we can rule out any other issues. And again, later on I'll talk about what is a typical challenge for different age groups, what's something that may improve over time or just maybe part of their developmental age, and then what is something that is more concerning and that you may want to seek help for. But this is just kind of a general overview. Again, when you seek help from a mental health professional, there'll be specific criteria they're looking for, the time period that this is happening, things like that. So some things that you may see in a child with depression would be depressed or irritable mood. So not just sadness, but in children it can also look like general irritability. And again, I'll talk later for different age groups, because you may be thinking, well, my child is irritable, and in different age groups that may occur as part of development, but in depression this may also look like just general irritability, or definitely a change from previous functioning where you're seeing more irritability. Difficulty sleeping and concentrating, that could either look like sleeping too much, not sleeping enough. Changes in grades, and general problems at school that weren't happening before. Changes in eating habits, so eating more, lacking an appetite, feeling angry or irritable, general mood swings, feeling worthless or restless, infrequent sadness or crying, loss or energy, low self-esteem, and also important to note, thoughts of death or suicide is another thing we're always looking for in terms of depression, in both children and adolescents. A little bit more about depression. So another thing that a mental health professional will be looking for is kind of the time frame of this happening. So is it lasting more than 2 weeks is kind of the general time frame we're looking for. And then is it interfering with daily functioning? That's another thing to just be aware of as a caregiver or a parent. Is this affecting my child's daily functioning in such a way that we might want to seek help? And also time frame. Children can experience a depression, after a traumatic event or a loss in the family, grief, things like that, all times when depression may occur. And it can also occur more than once throughout their lifetime. So there's a different diagnosis for a more chronic type of depression, but for some, just thinking of like anxiety specifically, some kids that struggle with anxiety may experience it when there's different changes, moving to new schools, also just at different developmental stages that may crop back up. So kind of thinking about this may be a problem that they're continually having to address throughout their lifetime. So with depression. And then some different risk factors for depression specifically. So having a family history of depression, if parents specifically are diagnosed with depression, or a sibling, that can be a family risk factor. And while it affects both genders, it seems like girls are more likely to experience depression during adolescence. But at the same time, I want to note that boys can also, we really want to be looking for that, and it may look different in males than it does in females, but we do see that females seem to be more likely to experience that during adolescence specifically. And then the depression is also a risk factor for suicide. So again, I'll talk a little bit more about suicide risk and things like that, but that's something we're wanting to look for in terms of experiencing depression in childhood. Okay, so then about suicide risk, something I kind of want to specifically address in terms of depression. So sadly, we are seeing that suicide rates in children are rising, and actually the greatest increase seems to be in females. So kind of closing the gap a little bit in terms of suicide rates was more in males, and now the female rate seems to be on the rise. And actually specifically the biggest rise in ages 10 to 14, which is quite a bit younger than we were seeing it before, that's becoming more common. So then some of the warning signs, things that you may or may not have heard before, but making suicidal statements obviously is definitely a warning sign and something we want to take seriously. Being unhappy for extended periods of time, withdrawal, again, kind of a previous change in functioning, so withdrawal from friends, activities they previously enjoyed, but also becoming increasingly aggressive or irritable can also be a warning sign or a risk factor. And then another, I think, important thing, possibly a misconception with some, is that actually asking a child directly about suicide is not going to trigger, we don't see that it triggers them to actually think about suicide or suicidal behavior. So that's something we're wanting to specifically address with kids and asking them about those thoughts and those feelings. That's something we want to do, and not having the concern that that's going to make it worse, because I know that is kind of a concern that we might have as caregivers. We don't want to put thoughts in their head. I've heard caregivers say that, so that's not something we find. And then if you see any of these warning signs, just kind of reminding that seeking help from a professional, an assessment, it's always okay to get an assessment for that type of thing, so that's important. And then also kind of wanted to mention that I'll talk a little bit later too, but just the rise and kind of the influence of social media for our kids and just media in general, that we want to take that into note. So I'll talk a little bit later about social media and kind of its impact, and I don't have all the answers about how to manage that, but just some things we can be addressing with our kids that have access to social media. So. Okay, so moving on to anxiety, talking more specifically about that. So again, kind of like I mentioned before, anxiety can be a normal part of childhood, and in fact is a normal part of childhood, having different anxieties about things. At different developmental stages, anxiety or increased anxiety may be part of that developmental stage. Any of you that had preschools know that they're preschoolers, there's a lot of fears and nightmares and separation anxiety. A lot of that can be normal at different stages, but for a child with an anxiety disorder, the phase is not temporary and harmless like it might be in some kids. So children with anxiety disorders kind of experience that fear and nervousness that may lead them to avoid places, avoid activities they usually enjoyed. It's really kind of a more intense anxiety than you would expect, and not one that can be squelched by just the reassurance. So kids with anxiety disorder, that reassurance may not be enough to help kind of quench their fears about the anxiety. And we also find that if anxiety disorders are not addressed, that those kids can have poor school performance, missing out on important social experiences, and other high-risk behaviors. So this is an important issue to address as well. So again, for the anxiety, we're looking at kind of a change in functioning from their daily function. And I'd say this is some of the most common concerns that we see, at least at my agency, is children with various forms of anxiety. Even if they don't meet criteria for a diagnosis, like some form of anxiety or another is probably one of the most common things we see. So always doing an assessment to rule out what might be going on, I think, is helpful for these kiddos. And going a little bit more into anxiety disorders. So again, these are just very brief and not giving the full criteria for diagnosis. You'd always want to defer to a mental health professional, but just kind of wanted to talk about the different types of anxiety in brief. So generalized anxiety is one diagnosis. So many anxiety disorders, and then a couple disorders that are closely related to anxiety. But more generalized anxiety, so you're seeing an excessive worry about a variety of different things. The kids may be overly perfectionistic or need kind of that constant approval and reassurance. And again, it has its own specific criteria that the child would have to meet for that disorder. That is one type of anxiety that we see in children. Another type, panic disorder. So that involves specifically having panic attacks, in addition to having fear about panic attacks. And then separation anxiety. So that's one of those types of anxieties that's seen as typical at certain ages. So thinking about when your children were about 1.5 years up to 3 years old, separation anxiety is something we see normally when they first start school. That maybe something's normal. But children with the separation anxiety disorder, so if your child's a little bit older and is not easily redirected when they're having separation anxiety, or when they're left somewhere with another caregiver or at school, that they're not able to calm very easily, feeling like you can't leave them with close relatives, that would be more in the lines of possibly a separation anxiety disorder, and that most commonly happens in that 7 to 9 range. We're seeing. So again, that's kind of a separation, different diagnosis that we see is different from a normal developmental separation anxiety. And a few other diagnoses here that we'll talk about. So social anxiety disorder. So again, social anxiety or social phobia. That's an intense fear about social interactions or about performance, such as being called on in class or having conversations with others. That really impairs their performance in school specifically, but also socially impairs their performance. Children can also have specific phobias, so that's an intense fear about a very specific thing. Again, I'll talk a little bit about later, kind of in the preschool age, that sometimes fear to the extent of a phobia can be normal, but we're talking about, for maybe an older child, kind of a specific fear that impacts their functioning. And then kind of two closely related disorders to anxiety, so obsessive compulsive disorder. So that again has its own specific criteria, but you're seeing kind of some unwanted and intrusive thoughts and feelings compelled to perform rituals and routines to try to ease that anxiety. It's most common around the 10-year-old age, but it can also strike in younger children as well, but we commonly see it kind of in that older grade school age. Boys more likely than girls. Before puberty, and girls more likely into adolescence, we might see a diagnosis like that. And then I'm going to cut off at the top, but post-traumatic stress disorder is another closely related to anxiety I wanted to talk about. So children with PTSD or post-traumatic stress disorder have an intense fear and anxiety. It may also become numb or irritable, maybe avoiding places, people, or activities after witnessing or experiencing a life-threatening event. And for every child or every person, that's very subjective about what's life-threatening. So if we all witnessed in the same room, witnessed a car accident, all of us may react differently to it. Some of us may rush out to help, some of us might freeze, some of us may, react differently, call for help, lots of different reactions to the same specific incident. So again, in terms of trauma, it's very subjective and case specific. So again, not everyone will experience a trauma the same way. And also, not every child that experiences something that's traumatic will develop PTSD. So we see a lot of kids in our practice that may have some traumatic stress, or maybe experiencing some symptoms after a trauma, but won't necessarily meet criteria for PTSD. It's normal to have some changes after a traumatic loss or a traumatic event, some changes in behavior, and normally those kids will recover in a short time, but this is really kind of a prolonged and more intense reaction to a traumatic event. And those who are most at risk for developing PTSD are the ones who directly witnessed a traumatic event or who suffered directly from that traumatic event. Also, those that had a previous mental health diagnosis might be more at risk, or that don't have a strong support network. All those things kind of put us at risk for PTSD. And also, violence in the home kind of makes it more likely that a child might develop PTSD. Different temperaments, family history, all things can kind of impact a child actually meeting criteria for that diagnosis. Okay, so moving on to kind of the different age groups, what you might see at those ages. So I kind of broke them down into different chunks and tried to, it's not exhaustive, the list of things you may see at different ages, but hopefully it will give you a good idea of typical things you might see, typical challenges. So starting with early childhood, so preschoolers specifically, things you might see as a challenge was experiencing a wide range of emotions, having a lot of ups and downs. Their emotions can be very intense because they're just learning about them, and they feel very intense, especially when they're tired, stressed, changes in routine, all things that can affect a preschool type aged child's emotional levels. Crying, whining, separation anxiety again is still typical at this age. Although some kids can be more intense than others, this is something that we still see at this age. They can also be inflexible, overly sensitive, easily upset. Temper tantrums and aggression is something that's still common at this age. And also those fears and anxieties. So having frequent nightmares, developing fears to the extent of a phobia almost, around specific things. And usually, kind of wanted to know, usually by age 5, kids can start verbalizing their emotions, but they still might have kind of those intense fluctuations in emotions. Even when they can verbalize, they still may have kind of those big emotions. So that's something we would still see. And then moving on to what are some things that you might be more concerned about in the preschool set? So I think for every age group I mentioned this, but when your child's behavior and abilities are significantly different from what you observe around other kids their age, and not to see that every child develops at their own rate. A lot of concerns we hear from parents of young children is like, is this normal? But that also happens across ages. Is this normal? They can't do what other kids do, and so for development, each kid does develop at their own pace. But if you're seeing that your kid is having widely different abilities or behaviors from other children their age, that may be something that you might want to seek help for, or just ask a question from a professional, is this normal? Having extreme separation anxiety or extreme withdrawal, withdrawal from peers, just withdrawal in general. Temper tantrums that are extreme, or feeling like they lack self-control kind of more so than peers their age. Significant sleep difficulties, and if you have a preschooler like I do, you might say, well, there's sleep problems all the time, but we're really looking for like a significant, the child's not sleeping hardly at all at night, just significant sleep problems that don't seem to get better with help, so significant sleep concerns. Severe or prolonged anxiety and stress. So with a lot of these things, I think we used to think that preschoolers or early childhood age, that their depression would look a lot different from an adult, that it would look more like what they called masked symptoms, so more like stomach aches, headaches, things that you couldn't necessarily see from the outside. We're actually finding that preschool depression specifically some of the symptoms look a lot more like an adult's. So that just lack of energy, lack of enjoyment and play, things like that. Also the difficulty at this age is it's hard for someone to picture what a depressed preschooler looks like, and so there's just a lot of research out there for what that might look like, but what's hard to picture is that a preschooler with depression also will have periods of having a more bright affect and may seem like they're acting normal, but then also those periods of kind of withdrawal and kind of a more similar to an adult type depression symptoms. So kind of wanting, again, to look in that change in functioning. So that little interest in play or in developing friends at that age. Excessive phobias that affect daily functioning. So again, that fear can develop, but we really want to see like excessive phobias that affect their daily functioning. Children that are highly aggressive. And then in terms of like potty training, we're seeing like frequent accidents or having trouble toileting kind of more past the age of 5 during the daytime. So up to then you may see some accidents, but if your child is past age 5 and that's still a frequent daytime problem, something you might want to seek help for and figure out what's going on there. Okay, and moving into that early grade school age, and I'll also talk about later grade school age here in a second, but early grade school age, so some things that you would see is like typical challenges, so continued bedtime fears, and needing more reassurance than most kids their age, having more defiance and arguments with parents, again, something that can happen in this age, but that's not frustrating to parents, but something that is kind of typical for this age group. Being highly sensitive to criticism and correction, and they might respond with intense emotions. We see that as kind of typical for this age, a typical challenge. More performance anxiety, so again in school as you get to more talking in front of the class and projects and concerts and things like that, kind of more performance anxiety. And they may still get emotional when under stress, hungry or tired, still affected by their environment quite a bit. And then specifically by age 7, some kids become more withdrawn and quiet. That does cause some concern for parents that their kid is becoming more withdrawn, and also just generally more serious and sensitive to rejection from peers or also from adults. And then by 8, we kind of see that children can become pretty self-critical, and they also might start limiting how much they share with adults in terms of their anxieties and fears. So some typical changes, but still challenging to caregivers that you might see in early grade school. And then when might you want to seek help for this age group? So again, if your child's abilities or behavior seems widely different, if you have other children, or just around other kids their age, if you're seeing that they're extremely different. Also extreme aggression, again, if it's kind of to the point of getting in trouble a lot for being aggressive, something we may want to check out. And then with that, being sensitive to criticism or anxiety about performance, if your child's becoming highly discouraged to the point where they're avoiding doing new things or learning new things, something that may be of concern. Again, that withdrawal and not playing or interacting with other kids their age. Bedwetting and sleep difficulties, still something that might signal that something's going on. And then that separation anxiety from caregivers, or also extreme anxiety around their performance, so much so that it's impacting their daily functioning. And then late grade school. Does anybody have any questions before we move on? No, not so far? Okay. So later grade school age children. So some things that you might see are challenges: tendency to worry or become anxious, get their feelings hurt easily, again, kind of that overly sensitive even into the late grade school age. Their internal emotional world is still pretty intense, and so they may talk about things with peers or just talk about things in general that parents or adults may think like, well, that's not that big of a deal, but their internal world is pretty intense still. They may start to become more detached or disinterested in parents or family or caregivers, and kind of we see like a shift to more focus on peers than we do necessarily on family. Again, the performance anxiety, so being more anxious about their academic performance, worried around test taking, so kind of a more, just more anxious about school performance. Can be pretty perfectionistic, self-critical, and avoidant of situations specifically in which they think they'll fail to some extent. That's typical for this age. By age 10, again, that focus is shifting more from family functioning to really this focus on peers, which kind of creates more issues in general, but they are kind of shifting their focus more to peers. Being more argumentative, that again is something normal for this developmental age, kind of using those negotiation skills a bit more, so it can be more argumentative, and then also still very sensitive to correction. Even when you don't feel like you're being critical, sometimes a child this age perceives it as criticism pretty intensely. Kind of less interested in like skill-based activities, so like sports and things like that, to the point where they may want to like drop out of sports they previously liked. And then their moods can still be pretty unpredictable at this age. And then when to seek help for some of these. So again, any change or anything you observe that's widely different from other kids their age. And again, kind of judging that, is it impacting my child's daily functioning? So are they worrying to the point where it's interfering with their daily life? We can't get up and get going in the morning, like refusing school, not being able to do the daily tasks or things they need to do to get through their day. Withdrawal from situations, and because of a fear of failing. So not just becoming disinterested, but just really not engaging in new things because of a fear of failing. So again, impacting their daily functioning. Becoming so overwhelmed that they can't function from school situations or making friends, kind of an intense focus on that. A severe prolonged anxiety or sadness. So again, not just kind of a period of a few days where they may seem sad or withdrawn, but kind of just a prolonged time period of that. Disinterested in peers, and then with that opposition and argumentativeness and moodiness, something that may impact their daily and functioning. You're getting lots of reports from the school that this is impacting them, things like that. And then also at this age, bullying really becoming more, although it happens at younger ages, but either your child bullying another child or not knowing how to respond to a bully or experiencing bullying themselves, another reason you might want to seek help for this age group. And then moving on to our last age group here, so adolescents, teens. I know there was a few people in here that also had adolescents. So again, a lot of the developmental stages actually, or the developmental stage or tasks actually mimics what you might see in a preschooler, but now they're like a fully functioning, not quite adult, but heading that way. So that presents with some new challenges. So some things you might see that are frustrating to caregivers, but we see as like kind of typical, would be staying up late and sleeping in. An adolescent's internal clock doesn't really work with the rest of the world, so wanting to stay up late and sleep really late is pretty normal for this age. Just moodiness, frustration, irritability, from time to time. Now again, if it's happening all the time or constantly, again, something we want to seek help for, but that irritability that's happening from time to time, just because this is such a period of transition, so that's bound to happen from time to time. Some stress about grades, test taking, not really wanting to do schoolwork, that may be something we see as normal. Wanting to push kind of boundaries, go outside the norm, sometimes getting in trouble would be typical for this age. Experimentation with drugs and alcohol, and I'll talk more next about when we want to be concerned about that. And then being secretive or just wanting privacy about some aspects of their life is something that's generally normal for this age group as well, becoming more secretive. And then when might we want to seek help for this age group? So if your child, even with a normal sleep routine of a teenager, when they're wanting to sleep all day, isolating themselves from others, or on the flip side, not being able to sleep at all, another cause for concern in this age group. If their moodiness and irritability is escalating over time and they really just can't cope with normal settings, and then also any type of violent behavior, something we'd want to look into. And then in terms of the worries about school or avoidance of schoolwork, if they're avoiding so much or worrying so much that it's affecting sleep schedules, sudden changes in grades or changes in behavior at school, something we want to look into. Being extremely rebellious, so like to the point of breaking the law, frequent detentions or suspensions, all things we would want to look into. And then in terms of drug and alcohol use, so using with any kind of frequency, or also being so secretive to hide some things or hiding risky behaviors. Another cause of concern, and a lot of questions parents have about like what's typical. So any kind of frequency, are they using it to cope, kind of wanting all things that somebody would want to assess. And then at any time, with any age really, but in the teenage age, if you're ever unsure of what to do and you're concerned for your child's safety, I think that's for sure a reason to seek help from a professional. And then lastly here, just kind of some other special considerations, and then kind of I'll talk a little bit about what to do, and then also why is there this increased risk. So LGBTQ youth, kind of a specific population that's more at risk. So there is some statistics up there about that, of what puts that group of children and teens more at risk in our communities. And then just adolescents in general being more at risk. So according to the National Institute of Health, nearly 1 in 3 will experience an anxiety disorder, and I think the statistic I gave earlier. Same thing with LGBTQ community, 4 times the risk for depression, and twice as likely to feel suicidal, and then 4 times as likely to actually attempt suicide. So kind of some factors that might put certain populations at risk. And then just teens, we're seeing kind of a rise in anxiety disorder. So between those 2 years, it went up by 20%. So seeing a lot more anxiety, and I'll talk a little bit about some reasons that may be happening. And then we're also seeing that hospital admissions for suicidal teens has doubled over the past decade. So seeing a lot more teens accessing hospital care for concerns like this. So then why is this risk increasing? Lots of factors I think likely are in play. So one thing is higher expectations and pressure to succeed. If you have a child in school, you know standardized testing is something that's very important. And then just a general culture of achievement. So some stress and anxiety is understandable given all those factors. Another thing to consider too is a world that is scary and threatening. I'd be remiss not to mention the school shooting that happened today in Santa Clarita, and so places that used to feel safe are not feeling safe anymore, and as your child gets older, there's more awareness of what's going on in the world. We know a lot more about what's going on in the world, and so just a general lack of feeling of safety for kids and adults as their caregiver. There's just a lot more anxiety around safety than there used to be, and a lot more awareness of what's going on in the world that I think has led to kind of more anxiety for sure in children. The effect of social media, so kids younger and younger being involved in social media. And so technology for sure has improved our connection to other people and lots of other opportunities that teenagers, kids, and adults wouldn't have had without the connection to technology and social media. But kind of with that has become just a way that social media can affect self-esteem and just general worldview. So it's difficult, especially for younger kids and teenagers, to not compare your life and your social connections to what you see on social media, that is just something that's at play that wasn't in play even a decade ago. So a big thing that's kind of has changed over time that's impacting our kids, and I'll kind of talk about just some brief suggestions of what to do that. Again, I don't have all the answers, but again, it's kind of something that has benefited us, but also kind of brought some more challenges as parents and for kids. And then also just that some children also have disproportionate reactions to normal development, so they might have worry excessively about things, usually like shortly before they hit puberty, just more about sleepovers and parties and school. Some kids just respond to that kind of more strongly than other kids might, so that's something to consider as well. And then again, just some brief suggestions about what to do, even though I know we're also going to have a talk about more resources that you guys have in the community and how to access help if you need it. But knowing the signs, so knowledge is power. Not that you want to diagnose yourself, but just knowing that some things to look for or when to be concerned, I think is important for caregivers. Being open and talking openly about things that stress your kids out. It's difficult, but kind of putting yourself in their mindset, I think, is important too. And so helping them keep things in perspective, if you can also see from their perspective, is helpful. Being mindful of the expectations we set for kids. Are they realistic? Talking about social media and technology use. So helping them take breaks. Things that you might do for yourself in terms of social media and technology, helping them learn how to take breaks, and also helping them realize the impact it has on their life. So when they're stressed about something that they saw on social media, helping them kind of connect how it might be impacting them. And then seeking help from a licensed professional, so that could be social workers, psychologists, your pediatrician, another mental health professional, connecting with your mental health professionals at your school about how to seek help. All good ways to kind of get more help and more information about your child. And connecting with the school environment, I think, is a good way to go too. So just some brief things of what to do. I can also give information about my specific agency. I don't have a card, and the card would have my specific number, but we have like a central intake. So if you guys want the number, feel free to catch me afterward, and I can give you the number to our intake coordinator. If you're interested in just getting an assessment, talking to a professional. Again, we're using at least 3 sessions to collect information. It doesn't mean that your child will need ongoing therapy, but it's something that we'd be doing to decide what the best steps are and how to help you and your family. So again, just some brief things to do to try to help our kids. So, do you have any questions about anything? All right, well, I appreciate you all. I hope this was helpful. And yeah, you can catch me afterward if you want more information about how to contact our Little Haven. And that's it for me. Thank you.
Thank you so much. Super informative. My name is Dr. Schulte. I'm the coordinator of counseling and character education, just in case if you weren't here at the very beginning. I want to thank you all for coming out tonight. This is a topic, just mental health in general, having been in this field for a while now, being in school counseling, it's something we're seeing an increase in our students, as Jessica said. We're seeing more severe issues, we're seeing more concerns. But another thing we're also seeing is that people are willing to come out to learn more about it, and we've removed some of the stigma, I think, that used to exist around that. And you just being present in this room is a huge part of that. So I want to thank you because, you know, even 5 years ago, this is a brave act to show up at an event like this. So thanks for being here, and I also want to plug our middle school counselors really are doing a wonderful job. They want to promote and remove the stigma. So tonight, Northeast Middle counselors, thank you so much for organizing this. And my main purpose of just speaking with you tonight is that the school counselors are here for you as a resource, for you as parents and for your students. So we are trained in basic mental health first aid. So the things that come up, a big part of our job is what's called responsive services. So if your student or another student is having an issue at school, school counselors are trained to respond to that and help out with that. And so there's a lot of, like, I think our school counselors they're busy, don't get me wrong, but they're underutilized as well. I don't think parents always often think of them as such like a first stop when you're concerned about your student, or if you're having a concern about one of your student's friends or something of that nature. The school counselor is a really great place to start. So if you have a concern, on the front end of that concern, if you go to the school counselor, they can help you talk to your child about that concern. They could help you facilitate a conversation if that's where you feel like you are. They can also help your child facilitate a conversation that your child wants to have with you as well. If they're like having trouble articulating to you what they mean or what they think or what they feel, the school counselor is a great resource for that. And then the school counselor also can kind of help you decide where to go from there. So there's, as we heard, just a broad spectrum of things you might be concerned about. Some of it might be completely where they are developmentally. And in those cases, the school counselor is a great resource to help you communicate with your child, to help you and your child understand what are some coping mechanisms they might have. How might they be able to talk it out? And it could just be you keeping a little bit more of an eye on them and us keeping a little bit more of an eye on them, and that might be that. For the more, kind of severe concerns, or where we decide we might need outside help, the school counselor can sort of help you with that decision. Here in Parkway in particular, we have a list of outside counselors that we've vetted to some extent. I have printed out some lists, but on the Parkway website, under student services, there's a counseling link. and this list is online on the Parkway website. And what we collected from these counselors, and usually it's people within the area, so if you live around here, not a far journey for you to travel. But we also have what do they specialize in? So if you're concerned that your student might have anxiety, you want to find someone who specializes in that. We've found what are their specialties as far as age goes. So some counselors only work with preschool students, which, as you can imagine, is really different if your high school student is having an issue. We also have, and this is just a big one in this area, unfortunately, but what insurances do those counselors accept? Because that can be a big barrier to getting outside help, is the cost of outside help. So different things like that, and we also have their contact information as well. That is a daunting task, and one that's not easy to navigate all the time, but please know the Parkway School Counselors are here for you to help you with that process. If that's something you're thinking about doing, they'd be a great resource for you to just bounce some things off of and get kind of their perspective. Things that, that we offer within schools, some of our schools are doing small group counseling. We also have, as Jessica mentioned, she's with the Children's Service Fund. We have outside counselors in some of our buildings doing work with kids during school hours. So that's certainly something that you can ask the school counselor about setting up if you think that that's something your child could benefit from. And then I really think this is important too. If you're already at the place where your student is getting outside help and maybe it's going well, maybe it's just going, but keeping that school counselor informed of how those sessions are going can be so beneficial, because oftentimes we are with them more than anybody in the world is with them. We spend so much time with your children and we love it, but we are with them, and you can, if you seek outside help, you'll notice that there's different approaches to the same problem depending on the student. So what we hope that you would share with us is that we could contact that outside person so that we make sure that we are following what their treatment plan is, so that we know what their treatment goals are, so that we can support that, so that we can help that, and so that we can just further that at school, working in conjunction with you and the outside person. So if they are already receiving help, that's a really nice thing to do for us, so we can be of service more to your student. Additionally, if unfortunately you ever have to go through an experience of like a hospitalization or something like that, just keeping us informed of that so we can help you and help your student with a re-entry plan into school with things like anxiety and depression. One of the hard things is that school might be causing some of their anxiety, and it can be hard to get them to keep coming to school, but once they sort of stop coming, that thing that they're scared of becomes scarier and scarier and scarier. And so our goal is to keep one foot here at all times, because healthy students attend school, right? So we hope that we are making this a comfortable place for them to be, no matter what they're going through. And so if we're communicating with you, if we're communicating with the outside person, that's how we serve your children in the best way that we can. We also, in Parkway, not only just have school counselors who are wonderful, we also have school social workers who might get involved or who you might ask for help from. If any of your students are in high school, we also have what's called a care coordinator position at that level, and we're looking to expand that program here in Parkway as well, because it's been pretty successful, and we're seeing a lot of benefits of having that position. So just reaching out to your school, seeing what we can offer you. Again, not that we're not busy, but I do think sometimes we're underutilized as like, hey, I just want to bounce this off of you as a parent. We're open to that. We're happy to do that. We're trained to do that. And I will say that, like, in Parkway in general, from the superintendent all the way to pretty much everyone who works here, your children's health and well-being are always the #1 focus that we have. I personally feel, as a coordinator of counseling, some of my counterparts, there are different districts where they're not quite as supported. It's not that they're not supported, but they maybe don't take such an interest or know what's going on. I'm in pretty constant contact with Dr. Marty, with our Board of Education about the efforts that we're making, and there's a lot of support for this work. And so I feel very lucky that our kids are supported in that way. We want to be proactive, we want to be reactive, we want to respond when you need us. So please don't hesitate to reach out to your schools, please don't hesitate to reach out, because we do have resources and just a lot of people that really, really want to help. So just reaching out and knowing that we're here for you as parents as well as your students as a resource. So that is all I have for this evening. Looks like there's one question. I have just a couple of these, but again, which you can take on the way out, but they are also Parkway website. Did you have a question in the back? Yeah.
We have a fifth grader who is obviously getting ready to transition to middle school, has seen a counselor, has an IEP. How much of the information transfer, can you talk a little bit about the fluidity of information sharing between the elementary school counselors going to middle school and then going to high school?
Sure.
Keeping in mind that we all understand HIPAA rules and things like that, but.
Right. Yeah, so with the IEP, the middle school counselors, and again, you're the experts, you correct me if I'm wrong, but the middle school counselor will go to the IEP at the elementary school, so that they make sure that they're involved and know what needs the student has with regard to their IEP. And then counselors share information, again, keeping FERPA in mind, keeping, that like need to know sort of basis, and also sometimes there's times where maybe the student has grown a little bit and you don't want to really, you want them to have a fresh start. So, but anything that's like that would be really relevant, really important, and or if the parent has said, I want you to share this with them, they have one-on-one meetings with their counterparts at the elementary school, and they get the rundown.
So is there a formal way for parents to facilitate that information transfer between school counselors?
Go ahead.
Yeah, and I can speak to that a little bit too. Feel free to reach out to your middle school counselor too. And so in case you haven't had a middle school before, there's a counselor for each grade level. So I'm, for example, currently the 8th grade school counselor at Northeast Middle, and I'm working on transitioning a new class of 6th graders in. So I've already been getting some phone calls from parents of 5th graders wanting to have some meetings and talk, and we're all more than happy to do that. And so anything that you want to share, you're welcome to contact the counselor directly as well.
Thank you.
Yeah.
I'm guessing most of us are here because we have at least one child we have a concern about their mental health. And I'm guessing there's lots of us in this theater that are here because we've had a child that's in crisis. I feel like I don't have enough information about what else Parkway has to offer. I feel very lucky I have Ms. Goldfeder, but I'm 100% sure she's not following us to Northeast, or to North High. I also think that when we were in crisis, I'm one of, I don't know how many hundreds of kids that she has. I felt scared, I felt alone. It's not that she wasn't helpful, it's just, it wasn't enough. I don't know if Parkway needs to give us more resources or needs to send us somewhere else, but there's not enough mental health professionals in the area. It's hard to find somebody, it's hard to find someone who takes your insurance, when they can get your kid in, can they get him in quick enough, all of those kind of things, and we're left, we feel alone. And I think that's part of just what we go through. You're just going to feel by yourself. But clearly we're not alone, and I know Parkway thinks this is important because this is the second mental health thing I've been to within the last year. I know the care coordinators are new. I don't know about other people, I don't feel like it's enough. We're in a good spot now, but I kind of feel like we're on the razor's edge, and anything that can bump us over and push us off, we'll be right back to Ms. Goldfeder. Thank goodness she's there, but I don't know that everybody has her, and I don't know that she's enough. So I don't know what Parkway, one thing is, what can we expect from Parkway? So if we move on to North next year and we have something, I know what she's done for us previously, is that to be expected everywhere? Is it just on our counselors here at the high school? I think they probably have more than each of you guys do at the middle school. It just doesn't seem like enough people to deal with what we know is becoming a big crisis.
So thank you for that comment. Yeah, I think, what you're expressing is actually a national trend and concern in general. Both in the medical sector and in the school sector, we're seeing more mental health problems, and there aren't the amount of professionals to respond. So one piece of that I'm encouraged by, actually next week, we're having a meeting with Senator Jill Shoup, who, like, a lot of what you're saying is actually kind of out of our control because of the way that funding comes through, the way that, and some of it is medical things, because if you think about it, I mean, we are a school. So we respond as a school system, it traditionally has been trained to respond. What we're seeing is new. So many of our staff, when I was even trained, it didn't look how it looks right now. I mean, social media wasn't what it is, different things. The world we live in wasn't what it is now. And so we are, in a sense, playing some catch up. I'm hopeful about the mental health task force. If you have heard about it, it's we ran it all last year, and we're putting those recommendations into place. And it is taking more time than we want it to take, but it's happening. So, like I said, North High next year, you can expect both the same level of care. Our high school counselors have similar ratios, actually, of kids that the middle school counselors have. They have the same 5 domains of their practice that they do. They have similar, like, Children's Service Fund resources, and also a care coordinator, which is something that's new, and social work support, and I would say maybe even a little more social work support than our middle schools have. But those are things we're working on. We're playing catch up, and that's, I would be hard pressed to think of any school system that isn't trying to catch up with that.
I don't know if we need to reach out to the board or what, but all of us that are here, I appreciate the task force, but it's not gonna help me if it's in effect in 3 years. Maybe it will, maybe we'll.
So the care coordinators,
We're struggling now.
we're put into effect now, and then next year the middle school will have them too. So the recommendations are, you are seeing the fruits of the labor now. We also just rebudgeted to put more money towards mental health. So those things are happening as we speak, and as quickly as can be done. I would also say, like, some of it is Parkway, and then some of it's the medical community, to be quite honest with you. And that's, we're in our locus of control where we are in schools, and I think we're doing the best we can. I would also say we are, and please reach out to the board anytime you have a concern. We are also presenting about the updates of the mental health task force at the December meeting. So we'll be, student services will be doing that. So if that's something anybody wants to attend, or they stream all of those events as well. Yeah.
If you have a child that's in a crisis and you contact your grade level counselor, what is the time frame? What is the expected time frame to hear back from them?
I mean, it probably depends on what the crisis is, to be quite honest with you.
Hospitalized.
I'm sorry?
If they're hospitalized.
You should hear back from them within 24 hours. Yeah. I did also want to plug, again, we're doing more and more of these events. The next one that we're going to do that's being planned by our middle school counselors is in February. It will be at West High, and the topic will be risky behaviors. It'll run a lot like this. We haven't set the exact date yet because we're nailing down our presenter first, but if this is of interest to you, please come, bring your friends. We also will be streaming all of these, so if you for some reason can't physically make it, this presentation as well, we've recorded and we'll have it online, so if there was something you didn't write down and need, or if you want to share it with a friend, we will have that up on the website probably by the end of next week. All right. Thank you all so much for being here. If you have any questions, I think we'll all be hanging around, so feel free to come up too.